Good afternoon. I am Ladina Bolton, your District 7 Commissioner and also the Chair of the ERPS Committee, which is Employee Relations and Public Safety. I am joined by our fellow committee members, Commissioner Marita Davis-Johnson and Commissioner Shakira Johnson. So we're going to just go ahead and jump right into the agenda. Have all committee members had an opportunity to review the minutes?
Yes, ma'am.
Do we have a motion?
I move to approve item 2025-0990.
Second.
All in favor? Aye. Motion passes. At this time, we're going to move forward with our presentation for today. If our presenter is ready and available, the medical examiner's office.
Yes, Madam Chair. So I believe Bianca Loveless will be coming up
There she
very
is.
shortly. I see her just running to the back to get some material. And so she is one of the newer members of our team, but has done an outstanding job. Came to us from the state, working in the same capacity or similar capacity. But she'll be able to share what's going on, what her observations have been, some of the key programmatic areas, and where we're headed in the medical examiner's office. So without further ado, Bianca.
Thank you. Thank you. And have it pulled up? Thank you so much. I don't know how to use the little clicker, but we'll figure it out, won't we?
Good to see you.
It's good to see you. Thank you so much for allowing me to speak today. I'm very excited to be able to tell you about what's going on in the medical examiner's office. I'll start with just a very brief overview. It's pretty rudimentary, so I apologize if you all are aware of the differences between coroners and medical examiners, but when I start using terminology, I want to make sure everyone actually understands what we're talking about. Let me get the presentation up. I can go ahead and start talking about it. Y'all probably already have printed copies up there as well, so you can follow along. But coroners and medical examiners are actually quite different. Many times those terms are used interchangeably, but coroners are elected officials. And so here in the state of Georgia, and it varies from state to state in the country, but here in Georgia they're elected to 4-year terms. They have initial training that is required, and then they have annual training, but that training can be somewhat limited. There's not very many hours that they have to go through, and they do not require any type of medical or law enforcement investigative training in order to be a coroner in the state. They do not perform autopsies. They typically in this state use a medical examiner or forensic pathologist for their autopsy services, and I'll get into that in just a moment. But they do respond to scenes, they conduct investigations, they pronounce death, they make sure that the body and the evidence is handled appropriately and that chain of custody is maintained. And so they do have a very, very important role in the state. In our office and in the other large metro Atlanta offices in Cobb, Fulton, DeKalb, and Gwinnett, as well as in the state medical examiner's office at GBI, those individuals are licensed physicians, and typically they're licensed specifically in forensic pathology. So that is a subset of pathology where they're actually trained to assess not only natural disease process, but toxins in the body for toxicology analysis, trauma such as gunshot wounds, stab wounds, blunt force trauma that you would sustain in any number of ways. And so they are licensed physicians, and they are typically either hired by a state agency like at the GBI, or they are appointed to their positions by whatever governmental body they answer to. These individuals do perform autopsies, and so they direct the death investigations, but they are not typically the ones that are on the scenes because they are handling the medical side of the house. And they very frequently, as is the case here in our county, have death investigators on staff who do those services out in the field that the coroners would typically do in a county that does not have a county medical examiner's office. They also determine cause and manner of death. Now again, just as a point, medical examiners have only 5 choices when it comes to manner of death: homicide, suicide, natural accident, and undetermined. Those are your only 5 choices. Everyone that dies falls into one of those 5 categories. Now, cause of death is innumerable, and you can have any different wording that you want based on your training and your expertise, and then your evaluation of that particular death for cause of death. So you may have the same death come through, and different doctors may change the wording a little bit on how they, sign that death certificate or put that in the autopsy report as cause of death, but it's their opinion that is going on to paper there. And then they are limited to those 5 manners of death. So in the state of Georgia, 155 of the 159 counties have coroners elected in office, 154-ish, depending on how you want to look at Clayton County currently. Most of them are using the state's medical examiner's office at GBI. So you can imagine GBI's caseload is quite large, and that impacts other counties, even if they're not using the GBI ME's office, because that impacts the toxicology turnaround time and other services that the state crime lab may impact. Again, in the metro Atlanta counties, when they have a population large enough, they can support their own county medical examiner's office, which is what we have here in DeKalb. So quick little history lesson. There was a referendum in 1978, which was approved by voters in 1980, establishing the county ME's office here in DeKalb, and the office commenced operations in 1981. We were the second county in the state behind Fulton to establish a county-supported medical examiner's office. And then our current facility, the building we are housed in now, which some of you have been to visit, opened its doors in 1997. So our building's not quite 30 years old. We have 12 investigators on staff, including our chief and 2 deputy chiefs. We respond to all death scenes within the county. And then obviously we take reports of death from various other entities such as hospital facilities, nursing homes, and the like. We are on duty 24/7, 365, including all holidays, and we take a variety of different types of reports of death. There were about 2,300 cases coming through our office last year. About, not quite 5,400 people or so are dying in DeKalb County every year, so about half of those end up being reported to the medical examiner's office. And then we whittle that down based on the circumstances and the medical history on whether or not an exam needs to be performed or we need to be involved in certifying that death certificate. We ended up doing not quite 1,000 exams last year. We pride ourselves on how efficient we are. We are very lucky to have the ability to use a private laboratory for toxicology in most of our cases, National Medical Services, and that allows our turnaround time to be far quicker than it would be if we were to use the Bureau for all of our toxicology. Almost 70% of our investigative reports are completed within the first month. So our investigators turn their reports around very, very quickly. Usually when there is some type of delay that delays that to either 60 or 90 days, it is because we're waiting on other investigative information or medical records, and those things take time to obtain. We completed 46% of our autopsy reports within 30 days, which is huge. That is a very, very big deal. Not many medical examiners' office turn around almost 50% of their cases in a month. And the NAME standard is that 90% of autopsy reports will be done within 90 days. We fell just shy of that. NAME has been a little bit more lenient. The National Association of Medical Examiners, which is our accrediting body, they've been a little bit more lenient about that in the last several years because caseloads are so high in the country. There is a shortage of medical examiners, which we'll talk a little bit more about in a moment. And so they know that turnaround time is slower for a lot of those counties in those states, so they've been a little bit more lenient with that turnaround time. We also complete over 70% of our death certificates within a month, again, which is very important to the public because if you've had a death in the family, then you cannot finalize any of their affairs without a final death certificate. And so we very much try to get those turned around very, very quickly so that our clientele, if you will, can then move forward with what they need to do to settle that estate. We also complete 98% of our examinations within 72 hours. So again, turnaround time is very, very important. We don't ever want to be the reason a family has to delay a service, for example. So we want to make sure we get those cases turned around quickly. We're able to do a lot of this so quickly and so
I'm sorry,
efficient-
Director Lovelace, can you advance your slides just because
apologies.
some of the information is cut off?
There we go.
Yes, ma'am. Thank you so much.
So part of the reason we are able to move so quickly and be so efficient is that we are unique. We are the only medical examiner's office in the country that operates under a public-private partnership, and this is quite innovative in our field. So the investigative side of the house, so our administrative staff and our investigators are county employees like myself, whereas our medical side of the house, our physicians, our forensic autopsy technicians, and our physician's assistants are all covered under a contract with Forensic Medicine Associates. So for those of you who have met Dr. Gowit, he's been here before with us. He's been with the county for many, many years, and he has a private entity that then contracts with the county. And that allows us great flexibility in our work. He also is able, under an agreement with his contract with the county, to conduct autopsies for other counties. So this is a really good symbiotic relationship because those counties then pay him. He can then pay more staff, which helps us turn around our cases quicker because his numbers justify him having that number of staff. So it benefits the county in many, many ways, turnaround time being one of them because he's able to hire more staff. It also benefits the state medical examiner's office because some of those cases are then taken off of their workload and sent to us. Dr. Gowitt is very careful about the cases he takes. He makes sure that he does not do prosecutable cases from other counties so that the doctors working here do not have to travel for court all over the state the way you would if you were in the state medical examiner's office. And it also keeps everything on our end a little bit cleaner so that we don't get embroiled in any other type of controversial type cases that would occur in other counties. So those are still sent to the state medical examiner's office for them to sort out. So we don't have to worry about that. But it's a really good partnership that we have, and it's been going on for many, many years. Dr. Gowitt established FMA in 1994. He responded to an RFP in 2000, so he's been providing these services for many, many, many years. His next cycle is up in the late 2026, 2027 year cycle, so we will be coming back before you with his contract should you wish to renew it again. Again, it allows us so much flexibility because it also provides cost savings to the county. The doctor's salaries, which are significant because they are physicians, are not part of our county pension fund. They are private employees under Dr. Gowitt's contract, so it does not impact the county and our pension services. And again, he's able to employ more individuals. We're also able to keep our caseloads lower per physician because he's able to employ more individuals. And that's a huge deal because we have such a massive shortage of forensic pathologists in this country. We have approximately 500 or so working forensic pathologists in the country. We need more like 1,500 to 2,000. So there's a huge shortage of forensic pathologists in this country. And so making our work more attractive to potential candidates is a big deal. And we're able to attract talent that way. So we want to keep their numbers a little lower so that we don't burn out those doctors so fast. And so it really does help tremendously. Now with our physician's assistants, the other ways that we're quite innovative in our field, we're the only medical examiner's office in the state of Georgia and one of only a handful around the country who are utilizing specialized forensic physician's assistants. This is a relatively new field. If you've ever been to the doctor and you didn't actually see your physician, you saw either a nurse practitioner or a PA, it's the exact same concept, but they're specially trained in forensics. And they are helping fill that gap with the shortage of medical examiners that are in this country. So they are master's level, they're accredited via all of their accrediting bodies, and they work under the supervision of the physicians, but it gives us a little bit more leeway and flexibility in caseload. We've also done quite a few data modernization and unidentified remains grants because Dr. Gowitt, again, has the ability to hire additional staff that you might not normally see in a medical examiner's office. We have public health personnel on staff. We have individuals who have specialized data and grant writing knowledge. So it really helps us seek out these other projects that we can work on that we might not be able to do if we did not have that partnership. We are able to use our data in various ways with various organizations. So we have Child Fatality Review is able to pull their own information. The state's DFACS office is able to, they have access to it and they can pull certain autopsy reports, for example, to help them with their investigations. And so we have a lot of these agreements with various and sundry groups. We partner with the DA's office to do unidentified remains grants to try to get those individuals identified. So we just have a lot of flexibility there. We also have an educational expert on staff that runs our entire internship program. And then we have specialized staff that got us accredited through ACGME. And that means that we can now host a forensic pathology fellowship. So not only is that a feather in the cap for us, but it also helps us train more physicians because we are helping the entire nation fill this void of doctors that we have. So our first fellow starts in July 1st, 2026, so we're very, very excited to get that up and running. And it's with Morehouse School of Medicine, so it is the first pathology resident program or fellowship program within HBCU in the country. So we're very, very excited about that. Another individual we have on staff is a public education specialist. So she coordinates all of our community events, a lot of our data that we release to the public when we get requests for information, either from the media or from community groups. We go out and we try to generate interest in forensic pathology because you have to catch them young. You have to get kids interested in pathology very young. A lot of times by the time you get to medical school, you already have an idea of what specialty you want to go into, and frequently that's not forensic pathology. It's all the much more fun, so to speak, disciplines, neuropathology or neurology or cardiology. And so pathology is not high on that list typically for doctors. So we try to get kids really interested in that young, and that means going out and speaking to middle schools and doing forensic science camps. And then we try to do as much education as we possibly can. Another thing that our public education specialist does is she works with Claritel. We do data for Claritel so that they know what communities are being hit the hardest in real time, so that they can go out and do outreach in those specific neighborhoods to make sure that we are distributing Narcan to the areas that need it the most to try to help abate some of the opioid deaths that we are seeing. And then again, we are starting up overdose fatality review. I'm very excited about this. My background, my specialty is actually child death and child abuse cases, and I've worked in child fatality review for many, many years, but there aren't a lot of other fatality review groups out there. There's some domestic violence fatality review, but there's not a lot of other specific types of fatality review. And when you look at very specific types of deaths and how those deaths occur and what led up to that death, then frequently you can target prevention efforts specifically to those individuals and to those communities. So we start everything else going smoothly and hopefully as planned, we should start working with overdose fatality review in the county in August. So we're very, very excited about that. And then as far as what's next for our office, we are looking constantly for ways that we can innovate. We are pursuing an additional accreditation. So we have been name accredited National Association of Medical Examiners for many, many years. We have no doubts that we will continue to receive that accreditation every cycle that it comes up for renewal. We are currently pursuing IACME, which is the International Association of Coroner and Medical Examiner accreditation. That focuses more on the investigative side of the house, whereas NAME focuses a little more on the medical side of the house. So to have both of those, again, is a big deal. There's only about a half a dozen offices in the country who have both. And then we also have our ACGME accreditation on top of that. Only 3 other offices in the country have all 3 of those accreditations, so we're very excited about that. Our staff continue to get certified in various and sundry specialties. We seek out American Board of Medical Legal Death Investigators, registry, and board certification, so our investigators sit for those exams. And we are just constantly trying to make sure that we are at the top of our game so that we can serve the citizens of DeKalb County. We would love to have any and all of you out. Dr. B has been out to our office, and I will be seeing Commissioner Patrick probably next week for a tour. Watching an autopsy is optional. We won't make you do that, obviously, if that's not your cup of tea. We know it's not for everyone, but we would absolutely love to have you come out and tour our facility, and we can sit down with you and answer any other questions that you might have. So thank you for your time. I appreciate it.
Wonderful. Thank you for that. I really appreciate that. You know, as a scientist, both myself and my chief of staff, we're really excited to visit with you guys and anxious for everybody to hear the amazing things that you have going on. I do have a few questions, but before I ask any questions, I want to defer to our other committee members to see if you had any questions or follow-ups from the presentation.
I have one. Okay, so thank you for being here. And I toured the medical examiner's office very early on. And no, I didn't see an autopsy. But yeah, so we have a medical examiner's office, not
Yes,
a
ma'am.
coroner.
Yes, ma'am.
Okay. And the medical examiner is appointed by,
He's under contract with
under
us.
contract
Yes.
with us.
So his private entity, Forensic Medicine Associates, contracts with the county.
County.
He provides,
Okay.
he provides the medical side of the house services for the county.
Okay, so you have the medical side
Mm-hmm.
and the,
Administrative.
I'm sorry, the investigative.
Administrative.
Yeah, administrative and investigative side.
Administrative, investigative side, yeah. Okay,
It's a very good symbiotic relationship. We work
Okay.
very well together. I'd known Dr. Gowett, for a while, just, again, medical examiners. There's not very many of them nationwide, so I'd worked with almost all of the ones that we have here in Georgia. So I knew him a little bit prior, and so we've had a very good working relationship so far during my tenure.
okay, that was my only question.
Okay. I just wanted to get a little bit of clarity on the symbiotic relationship that you indicated with, what are the counties? Well, it's cut off here, but you listed a series of counties in addition to DeKalb that the staff are able to support. Are there samples sent to DeKalb to be worked on? How does that work?
Yes, so there are three main counties that FMA covers: Henry, Hall, and Rockdale. Outside of their homicides, again, they do not send us their prosecutable cases, but their natural deaths, their drug overdoses, non-prosecutable accidents, so single-car motor vehicle accidents, things like that, there would not be any court action following those deaths. They would send those to FMA for autopsy. There are other counties that sometimes send occasional cases to us. I listed a few of them there. Richmond County, way out, in Augusta, White County up in North Georgia. They'll occasionally send a case to Dr. Gowett. And then Dr. Gowett's practice also can provide private autopsies. So you may have individuals, family members who want an autopsy on their loved one, but it's not indicated by law, by the Georgia Death Investigation Act, which governs everything that we do. It's just one law, but it's a long law. And so those cases may not be indicated for autopsy under law, but people can still pay for that service. And so Dr. Gowett can provide private autopsies to families that want them.
And are certain counties assigned to individuals, or they work on county specimen as the need is available?
Well, the DeKalb County cases are a priority. And so
Okay.
when we get started in the mornings, those are the cases that take priority. I have frequently had some case that may have generated some interest either via the media or there's a pressing law enforcement investigation. And so I'll make a call and say, this case has to go first today. I want those results as soon as I can get them. And again, that relationship has been going on for a while, so the staff are very, very agreeable to that. And frankly, they understand that the county comes first. But we have enough staff that we can easily make it through our caseload most days. Occasionally, there's some that have to maybe go to the next day, but for the most part, we get them done very quickly.
Gotcha. And when you indicate that he has the capacity to hire additional staff, is that full-time, or he's contracting maybe more support for certain projects?
We try to do full-time, especially with the physicians, because when you have doctors that are part-time, it's called locums, and sometimes you end up paying just as much for a locums as you would as for a full-time. And because doctors are in such high demand, locums can charge a lot. And so when the current chief at the Georgia Bureau of Investigation and one of the other associate medical examiners were medical examiners here in DeKalb for many years, and when the chief position became open and he took it and they left, Dr. Gowett was alone for a while, and he could not handle the caseload, so he had to hire locums. And so in certain circumstances, we could do that, if FMA deemed it necessary. But right now, we're in a very good place, knock on wood, but we're in a very good place, and we have full staff.
And with respect to training the workforce, of course, you indicated the huge deficit in forensic PAs overall. Have there been any conversations with, say, Emory, who's in DeKalb County, to maybe support not just our efforts, but maybe even the metro area? Because I'm sure everybody needs a little bit of help.
Yes, we actually work very closely with Emory. They actually have a fellowship program with Fulton County that's been in place for many, many years. GBI has a fellowship program with Medical College in Georgia in Augusta. So there are 3 forensic pathology fellowship programs in the metro Atlanta area alone. Emory medical students rotate for their pathology residency. They rotate between us, GBI, and Fulton.
Oh, nice.
And so we already have a very good relationship with Emory. And so sometimes if we can kind of convince those residents to maybe seek out pathology, now we have a pathology fellowship program that they could potentially apply for and enter.
Okay, and I have one more question. I'm sure some of the others may have, well, let me make sure it's one more while I'm saying that. Okay, yes. So I'm thinking about next year. We have a full year next year with the World Cup, and, we anticipate hundreds of thousands of people in and out. With respect to that and just in general, when we have major events in the area, how does that impact your capacity to serve? Does that increase your workload, and how do we offset those changes to stay consistent?
It certainly can.
Okay.
When you have big events, especially big events where people might not be on their best behavior, you may see an increase in caseload. It's typically short in duration, and we can absorb, a short burst of additional cases. If something catastrophic were to happen, we have memorandums of understanding with all of the other county ME's offices as well as the state ME's office in the area, so we could borrow staff and borrow facilities if we needed to, because we have that working relationship. We also, our office initiated a program called GAME, the Georgia Association of Medical Examiners, and we meet annually. And so we do presentations or, talk about difficult cases or things that might be of interest in our world and in the world of death investigation. But it also gives us a time to build those relationships so that when we need each other, we can count on each other.
Wonderful. So based on your response at this time, we're pretty prepared for what may come, and we
Yeah.
may not need extra support, or?
Well, I can tell you, we would be very judicious in granting leave for staff during the World Cup. We're probably not going to have a lot of people on vacation those weeks. We will definitely understand that it will need to be potentially all hands on deck.
Okay.
But we have a pretty high caseload as it is, and we're accustomed to, handling, cases where you have multiple individuals who have died in the same incident, for example. That's not uncommon in our world, so we're pretty well prepared for that.
Wonderful. Were there any other questions from commissioners? I'll go to Commissioner Davis Johnson and then Commissioner Terry.
Folk that are attending the World Cup, we only had one death during the Olympics,
Correct.
and that was the bombing. So don't think we have multiple deaths.
No, it certainly
We,
doesn't have to be that way.
No, we don't have to be that way. But my question is this, for those that may not know, because I don't know, what is the average cost for a private autopsy?
It varies. It depends on the nature of that case, what they're trying to get from that case, and what other testing has to be done. So an autopsy in and of itself is not a crystal ball. It can't tell you everything that you need. And there's a lot of components that come from that. Toxicology, histology. Histology is where you take small sections of individual organs and they're turned into slides so that you can look at them microscopically, and you may be able to see things that you cannot see with the naked eye at the time of the exam. And so all of those additional services cost money. So it depends on the nature of the case, but it's somewhere in the neighborhood of $3,000 to $10,000, depending on the case.
Thank you.
Thank you, Commissioner Terry.
Thank you, Madam Chair. Thank you, Director Lovelace, for the presentation. A few weeks ago, we were talking about opioid-related deaths and other drug or alcohol or substance abuse-related overdose or deaths. And in the past couple of years, we had the medical examiner had come to the committee and sort of given a chart, I guess, or maybe as a bar graph of like deaths each month and how it was related to that. And so it was interesting over the years to sort of track kind of the opioid overdose deaths, but I know you had other categories in there. So is that something maybe in the future, Madam Chair, that we could have kind of like a maybe once or twice, I don't know, whatever makes sense, an update on those statistics? I think it was sort of broadly, here's the, substance abuse accidental deaths, and then you had it broken out by, different categories.
Absolutely. We have that data, and we turn around very quickly. I was here a couple of weeks ago when our Director of Public Health was here and presenting not just county, but statewide data.
Yes.
Because we are only worried about one county in my office, and we can turn around our talks very quickly, we can typically get those numbers to you pretty fast. Our 2024 report is already uploaded on our website and is live. We did a multi-year chart for different types of drug-related deaths. Last year, about 38% of our deaths, give or take a 0.5%, were related to opiates, but that includes all opiates. So about 33% of them were directly related to fentanyl. The others were heroin, xylazine, which they call trank on the street, just sort of these odd cases that pop up occasionally of other classes of opiates. Just under 32%. I know the discussion that was had a couple of weeks ago, we also mentioned cocaine. So just under 32% of our deaths were related to cocaine. And I'm coming back in 3 weeks to do a talks presentation specifically, so I can bring any and all numbers that you want, for ever how many years you want them.
Any other questions or comments from commissioners? Did you have something?
Just
Go
a
ahead.
comment, just need to get on the schedule to do a tour. I will not be looking at an autopsy though. But this is very informative and really just fascinating to understand more about the medical examiner's office. I appreciate your presentation and the detail and information you provided, so thank you very much.
Thank you for having me.
Awesome. If there is, did you have something? No.
No, since I look forward to, seem like that cocaine and opioid comparison is pretty close.
It is. There is a certainly, and I will say, we had our toxicologists from National Medical Services, our private lab that we use. They come every year and present the year prior's data to us to give us sort of our own trends in-house. Methamphetamine is kind of making a little bit of a comeback as well, which is not what you want to see. So our numbers are going up just a little bit there. Overall, in the country, opioid deaths are down just a little. I would attribute that, to the availability of Narcan and public education and things like that. So, it fluctuates from year to year, but yeah, we can absolutely provide any data that you need.
Yeah, I look forward to seeing that. Thank you.
All right. Thank you so much, Director Lovelace. We
Thank you.
look forward to you coming back and joining us.
Thanks for having me.
Have a good day. All right, that was very informative. So we have, our agenda is not too long. We're going to go ahead and move into our first contract on the agenda. This is under Human Resources and Merit System, item 2025-0877. All commission districts. This is a request for proposal number 2024-100009. Background screening services, an annual contract with 4 options to renew for use by the Department of Human Services and Merit System, consists of providing comprehensive pre-employment background screenings on prospective employees. Recommend award to the highest scoring proposer who is responsive and responsible, HR True Check, Inc., amount not to exceed $689,375. I will say this sounds a little bit familiar. Didn't we have a pre-employment on the agenda recently?
Yes, good afternoon, Commissioners. A while back, we asked for an extension until we could get to this point.
I gotcha. Okay, and this would be through
This contract
July?
would take effect in September. Once you approve the award of the contract, it would go into effect in September.
Through September 2026?
Yes.
Okay. Any other questions or comments from committee members or commissioners?
No, ma'am.
Do we have a motion?
Motion to.
Second.
All in favor? Aye. Motion carries. Thank you. And it we have a walk-on item. This is,
Paying class study.
okay. This is also a request for proposal number 2025-100078, professional services for classification and comprehension study for use by the Department of Human Resources and Merit System. Consists of developing an enhanced classification system and associated pay plan. Recommended award to Evergreen Solutions LLC, amount not to exceed $404,500.
Excuse me, Madam Chair, do we have that? Walk on.
It's a walk-on.
Oh, it
Yeah.
was passed out this morning, because I don't know.
Yeah, so it was walked on this morning and added to the agenda for committee. While we look through that, you want to just summarize what this is for us?
Yes, we're long overdue for a pay and class study. The last study was conducted in 2014 with the recommendations implemented in 2016. So it is time for us to do another review of our organization's classification system and our pay rates.
And on average, we do it about every 10 years, is that what
Right.
it is?
Yes, that is
Okay.
correct. We did an RFP. We got about 13 responders. 5 were successful. There were some disqualified, and there were about 4 no bids. But 5 were successful. We interviewed all 5, and Evergreen got the highest score.
Oh, yeah, we sure did look at that. Overall, are we pretty good about staying current, or do we find significant deficits in areas where we need to increase?
Well, we do, HR does targeted reviews of pay. For example, police, as you all know, we have supported constant increases for police based on our assessment in terms of where we stand in the market. We've also done targeted reviews for the law department, for watershed. So we do remain pretty current. And anytime there was a cost of living increase, we made it a point to adjust our pay ranges. So the pay ranges should be pretty competitive, but we need to make sure where the people sit or in those pay ranges. How do they fare with the market?
Okay. Any questions or comments from commissioners? Commissioner Terry?
Thank you, Madam Chair. Director Ransom, I think it was 2.5 years ago, we passed a resolution, or maybe it was a year ago or 2 years ago, about increasing the minimum wage.
Yes, we
and then,
did.
And then kind of every 3 years, sort of just checking in to see what the minimum wage, living wage, I guess, would be in DeKalb. And I think we've been kind of ticking it up a little bit since the $17.
$17.68
So now
now.
$17.68. So
Yes.
is this also part of the pay studies
Oh,
to look
absolutely.
at that
Yes.
as well? Okay.
Absolutely.
Okay, thank you.
Any other questions or comments from, no? Okay. Do we have a motion for this item?
Move to approve the walk-on item.
All in favor? Aye.
Aye.
Motion carries. Thank you so
Oh,
much.
Thank you very much.
All right, the next item is 2025-0662, all commission districts. A change order number 2 to contract numbers 1315118 and 1315134. Uniforms for fire rescue services. This is an annual contract with 4 options to renew for use by the Department of Fire Rescue Services. This contract consists of the purchase of uniforms for fire rescue personnel. This request seeks to ratify a previously provided contract term increase, and it also seeks to increase the contract funds and terms through December 31, 2025, awarded to Nafico and Safeguard Printing and Promotional Products, Inc., total amount not to exceed $630,000. How you
Yes.
doing, Chief?
Doing well. Good afternoon, Commissioners. It's as you stated, this is to ratify the contract that did end at June 30th, and it was extended to July 30th, and then the extension would be until the end of the year. As you stated, the ITB for this contract is with purchasing, and I believe they believe that it will be awarded within that time period.
And the increase of the contract funds is up to 630,000 to include the extension through December?
Yes, yes, Commissioner.
Okay. Do you know what that difference is from, I think you said June 30, or was it July 30 through December 31?
The contract expiration date was July 30th,
Okay,
and then there was the extension that was done with purchasing to the end of this month. And then what's being asked also is for the, and that's what you're ratifying, but then the extension would be until the end of the year.
do you know what that amount is from July through December, that increase, just for that time period?
No, I do not, no.
Okay.
Yeah.
So it
I
looks
see
like
what
I'm.
you're saying, but,
Okay.
and I can ask purchasing if they're aware, but you're asking the extension beyond July 1st to the end of the year.
Yeah, how much was that amount?
If that's
630
630,
is the
it's
total.
just for that period or the entire period, I think is what I understand.
Yeah.
And so, going to ask Michelle if she can clarify.
Commissioner, it's our understanding that the requested 630 covers their need from the June through 2025, through December 31, 2025. As you're used to hearing us say, we were trying to make sure that the contract stayed alive until you had the time to review the agenda item and make your determination on yes or no recommending the change order. So what the dollar amount is from June to July, we wouldn't be able to give you that information because that's based on the usage from the requester. So
I gotcha.
we wouldn't have that information.
Okay.
We could maybe in August go back and look, but I don't know if that's going to give you what you're looking for. Ultimately, the 630 is supposed to cover them through December for all of their needs, whether it was June or July.
Yeah, no, that clarifies from July to December is where we get the 630 from, is what I'm hearing.
Yes, but they still had funds left. So this is a change order. So whatever funding they still had available,
Okay.
that's still in play. Unlike what happens with the renewal, which is use it or lose it.
Okay, I gotcha. Any other questions, Commissioner Johnson?
Yes, I just want a little bit of clarification. On the agenda item cover page, under recommendations, the estimated amount was 620,000. And then on the main blurb, it is actually the 630,000. So are we just a little bit more coverage for the estimate?
No, there were two vendors. So Navco gets 620 and Safeguard gets 10,000. So it's actually 2 pages to the main page.
Okay, thank you.
Any other questions or comments from commissioners? All right, if there's nothing else, do we have a motion?
I move to approve items 0662.
All in favor? Aye.
Aye.
Motion carries. Oh, sorry, I didn't even give you time. Thank you, sir. We appreciate you. The next item, 202-50902, all commission districts. This is a change order number 4 to contract number 1377240, Public Safety Communications Technology and Hardware Solution. This is a Sourcewell contract of number 042021-MOT for use by Fire Rescue, the Marshal's Office, and Police Services. This contract consists of purchasing through the competitively let Sourcewell contract for the purchase of APX radios, remote speaker microphones, chargers, batteries, and related accessories, device hardware, installation, and programming. This request seeks to ratify a previously provided contract term increase. This request also seeks to increase the contract term through June 30, awarded to Motorola Solutions, Inc., contract term increase only. Okay. All right, and there's a substitute for this as well?
Yes, ma'am. Good afternoon, Commissioners. We're actually requesting an increase of $1.3 million to the contract based on previous expenses and the anticipated cost that we will cover over the contract term through June 30th, 2026.
All right, so this looks familiar as well. Did we look at something similar earlier, a couple months ago?
Yes, you did. In May, I believe a different department made a request. So this is actually used by 3 different departments.
Okay,
Give me one moment. The historical information is in that second area of your agenda item. And so it does mention that the last change order that we came to you was May. I believe you guys have recommended approval in May of that request.
Yes.
and that was for the marshal's office, is that what? BRC?
It said marshals and E911 as well, looks like.
Yes. So this request today was for all of them to extend the contract term, but specifically the 1.3 million is a need for the police department. So this
Okay.
is why police is in front of you today.
Okay, an extension only through June 23, 26. Or, hold on,
Yeah, that's also extending the funds, the substitute.
okay. And this is really minor, so I just want to make sure that this isn't a typo. On the substitute, it says through June 23rd.
That is a typo.
Okay.
The document I was provided, I had to do a couple of revisions to, and so I lost track of the previous revisions I made to the original that you received. So I did miss that one. So I will submit a substitute to the substitute that corrects that, so that reflects June 30th, 2026.
Okay. Any other questions or comments from commissioners? No? Okay. Do we have a motion?
I move to approve the substitute for item 2025-0902, substitute clarifying that is June 30th, 2026.
Second.
All in favor?
Aye.
Motion carries. All right, so we have that one. Thank you. The next item, 2025-0583, all commission districts. This is an amendment to contract number 21-500571, towing and record services. This is a multi-year revenue generating contract for use by the Department of Police Services. Okay, and as I recall, there was some information that we had requested. Do you have that available for us?
I'm not familiar with any additional information that was requested. When I was out the last time, this was before ERPS, a presentation was provided to the committee by Captain Albritton regarding the questions from the first meeting.
Okay. I know at least one of the questions was, we just wanted some clarity on what prompted wanting to increase the towing of record service fees. Was it to just meet operational needs or something occurring in the industry?
Well, I think, DeKalb County has not increased this contract in many, many years, and part of the presentation did show the contract management and staffing hours cost for the police department. And based on the remittance that we would receive from maintaining this record contract in 2024, the police department spent $553,000 and $553,519 on costs associated with the contract, and received a total of $198,242. So it's costing us a lot of money to manage and maintain this, and based on the state standards for record contracts, we felt like it was agreeable to at least ask for some type of increase to recover some of that cost associated with what we're losing.
And I believe one of the questions, it may have been Commissioner Marita Davis Johnson inquired about whether when the services are rendered, if they distinguish between whether it was just because somebody needed help or it was because of a violation.
And we were not able, the record companies do not keep that
Okay.
specific data.
There was a request for any renewals or changes that we, or they, improve upon their record keeping, because there were several questions that the commissioners had that couldn't be answered simply just because of the way the records were kept, and that would have influenced their decision on moving forward with this item.
And I think that's something that we can put in the scope of work with any changes that we make.
Any other questions or comments from commissioners? I think those were the major things. Commissioner Johnson?
Just one question, maybe just clarification. So for this record service to be utilized, police has to make that phone call to the towing service?
No, ma'am.
So who
Any-
can?
Any law enforcement that does needs a vehicle record service, the entire county can use this record contract service, but it's predominantly used by the police. The marshals, the sheriff's department, they all fall under, the fire department, they fall under and operate under the same contract.
Okay, thank you.
Commissioner Terry?
Thank you, Madam Chair. And then just to follow up on that, so if there is an abandoned car on the highway, you put a little sticker on it, you don't take it in 24 hours, tow truck comes, picks it up. Or if someone parked at a county facility overnight for weeks and a car was abandoned there, I guess maybe facilities would call the wrecker in that case.
In some cases, it may be a private tow based on the parking restrictions on that area. We encounter that from time to time where a vehicle's left in a shopping center or something like that. We get with the management of that shopping center, and we'll still call them a wrecker, but it would be considered a private tow, and they would be authorizing that tow off of their property.
Okay, gotcha. And then just because this has come up, and I think we're actually going to speak with the departments on Thursday about this, but when it comes to like semi-trucks, like parking on both sides of the road, I think in the presentation, you said that we do have a vendor, or there is a vendor that can tow the
Big trucks.
large
Yes, sir.
trucks.
Yes, sir.
Okay, so that is available under this contract. And then I guess if we were to update the fees, it would just, all of the different sizes and tonnage, I think would go up just a little bit, looks like.
Yes, sir.
Okay. And then just to clarify, so again, the goal is bring the fee up to what the standard rate is in Metro Atlanta. It helps offset costs. We're not going to make up all the costs, but it
Correct.
will help offset some of the costs. That's some important cost containment, which I know the CEO is really focused on. And then certainly, I guess the vendors will get a little bit more as well. They have to pay their employees and do maintenance in light of everything else that costs more money
Yes, sir.
in their business as well. So I think the idea here, I guess, is if we get our fees up to the going rate, it means that police have a little more resources to work with. The vendors actually have the resources they need to do their job in an efficient way.
Yes, sir.
Okay, thank you.
Thank you, Commissioner Terry. Commissioner Patrick, did you have anything?
Just a final question for clarification. You mentioned the cost to the county under the current rate structure. Does the new rate structure bring us to cost neutral, or where does
No,
that
sir.
bring?
We would still be in a cost deficit. We're trying to be, consistent with many of the metro area counties. The state even says that we could go up to a $228 fee. We're not asking for that in this recommendation. We're only asking for $175.
Okay. And again, that's sort of in line with what surrounding
Yes, sir.
counties and jurisdictions are also
Yes, sir.
doing? Okay.
Atlanta does 175, Cobb County does 185, Clayton County does 190, and the state of Georgia is at 175.
Gotcha. Okay. Thank you, Chief. Appreciate
sir.
it. Thank you, Madam Chair.
All righty. If there is nothing else from committee members or commissioners, do we have a motion?
Yes, I move to approve item 2025-0583.
Second.
All in favor? Aye. Congratulations. That's been on the agenda for a while now.
Thank you. Thank you.
All right, so the next item is 2025-0683, all commission districts. This is a resolution to approve a resolution to address egregious littering and the illegal dumping of scrap tires. Would you like to speak to that, Commissioner?
If I could, I'd like to ask Mr. Marcus Allen to come speak with us.
Good afternoon, Commissioners. So in front of you in your agenda is Agenda Item 2025-0683, a resolution proposed by Commissioner Patrick to address egregious littering and the illegal dumping of scrap tires. This is an agenda item that is proposing a comprehensive solution to an issue that the county is facing regarding scrap tire dumping across our county. It's been really a pervasive issue for a number of years. And per the agenda item and resolution in front of you, the issue is that it's been plaguing residential neighborhoods and businesses across our county for quite some time. The goal is to develop a comprehensive solution for addressing this environmental, public health, and safety issue from a multifunctional approach. So with that, Commissioner Patrick and staff have partnered to develop a series of recommendations as well as strategies in conjunction with several of our county partners. We have been having several conversations with pertinent departments, including planning sustainability, our internal staffs. We've had a couple of conversations with our law department as well as our public works director to look at, some opportunities within the county code itself. And within your agenda item, there is a proposed ordinance revision to Section 22-69 of the county's code for unlawful dumping. Now, based off that, staff does have a couple of proposed changes based off, what you have in front of you. So, what I want to do today is set the expectation. One is based off Commissioner Patrick's review and, great ordinance draft, we would like to make some tweaks to that based off some of the initial conversations we've had. There's two conversations that I want to have before bringing this back to committee. And like I said, we've spoken with several departments already. One is our code enforcement officer, our director. I really want to have a comprehensive discussion with her to finalize some of the things that we have. We've developed a couple of different logic models that looks at this from a very strategic approach. We're looking at this from a legal framework, enforcement strategies, public safety approach, public education campaign, code enforcement strategies, planning sustainability strategies, tire remediation strategies. That's just from the local aspect itself. There's also a state legislative ask that Commissioner Patrick has proposed. We're not going to focus on that right at this exact moment. We're actually going to wrap those recommendations into your legislative agenda for 2026 and beyond to work with our state legislative partners. And then there's a regional approach as well. So through some of those conversations that we've had with planning sustainability, I think Commissioner Patrick, you were on the call a couple weeks ago or a week ago with our partners in Cobb, Gwinnett, Fulton. This is an issue not just plaguing DeKalb, but our region and our state, frankly. So there are a number of strategies that we're working on. We're going to request a 30-day deferral to have, one, the conversation with Director Clark, two, bring back a amended code adjustment based off Commissioner Patrick's proposal here that contemplates many of these things. And I think we've received some documentation from Commissioner Terry's office as well on this. So we want to wrap all these things up into one clean agenda item that you all can review and consider as a substitute, and bring that back this time next month in August so that we can, move forward with the code adjustment itself. So we want to focus on the local perspective and then move outward from there.
Thank you, sir. Any questions from committee members?
I have a
Go ahead,
question.
Commissioner Johnson.
So I am curious, the conversation that you're planning to have with Director of Code Enforcement, is there a way you can kind of summarize that conversation?
Sure.
In like a memo, so we can kind of just understand like where her thoughts were? I think that'll be a really integral conversation to this.
The most important aspect is one, the county's code itself. There are a few discrepancies within it. One stating, for instance, the Public Works Director will be responsible for the enforcement of such scrap tire remediation. We've spoken with the Public Works Director, and that's not necessarily the understanding of how it should be. So we really just want to get these things under the right house, right? Let's start from there. There are some other aspects from, obviously, an enforcement standpoint and identification of a lot of where this scrap tire is happening across the county, how we work proactively with many of the vendors that we have, whether they be, tire companies. I don't want to name any specifically, but, say for instance, you have a facility that has a ravine next to it or county-owned property that has instances of tire dumping. What are we doing to address that? How do we have the staff available to address these means? We've had several conversations and a couple of hours worth of conversations of how that might look. And there's frankly a lot of opportunity there. And this is really just going to be a pretty innovative strategy, honestly, when we take a look at what needs to be done from the environmental standpoint itself. But I think we have the team to get it done because we have a lot of dedicated folks. And like I said, I don't want to let the cat out of the bag too soon, but we have some really good strategies that have been, well thought out. And we want to run those with Commissioner Patrick first to make sure that he's aware and, then approach that with the ERPS committee and the Board of Commissioners as a whole.
Yeah, looking forward to it.
Yes, ma'am.
Thank you.
Did you have anything? Go ahead.
And you say that you would be ready for this to come back in
30 days.
in
Yes,
30
ma'am.
days, okay. That's it.
Okay. I'm curious, did any of those conversations include a registry for folks who are receiving funds and claiming that they are disposing of the tires?
That's part of it.
Okay.
And, from a public safety approach as well, we need to understand what our current landscape is when it comes to, one, our police department has done a great job of identifying our hotspots, right? But when, there may be a discrepancy in, the records that are received, what do we do in that instance? How do we enforce that? How do we prevent it more than anything? And I think that even CEO Cochran Johnson has stated very well a couple months ago is education is a very important aspect of this. You can't legislate morality at the end of the day, and those were, it was a great quote from herself. So we're looking to find a way to really address this from not only the enforcement aspect, but as we have in a public education standpoint. We don't necessarily have folks saying, well, I didn't know, therefore this happened. So these are some of the things that we're definitely taking a comprehensive review at or look at. And, we look forward to bringing those aspects back to the committee for your consideration.
Commissioner Terry?
Thank you, Madam Chair. Yes, I appreciate Commissioner Patrick bringing this to the forefront, and I was also doing some research on the Chapter 22, Article 4, Section 69, and so if it's okay, Madam Chair, and to the sponsor, since it looks like there's multiple sort of angles that we're looking at from the addressing this issue of scrap tires being dumped and littered on our streets and in our parks and abandoned properties. It looks like we're kind of moving it more towards sort of several ordinance revisions. So if it's okay with you, Commissioner Patrick, can we send other kind of idea code sections to sort of put into that research and have like an omnibus kind of ordinance package that addresses the penalties, the registry, I found the same thing, the Public Works Director is in charge, maybe we need to change that. So is that okay for us to send those to Marcus?
I would say please do, and I think Marcus was already looking in that direction for that.
Yes, sir. Please do.
Okay,
Thank you.
Comprehensive approach. Madam Chair, if I can also
Go
add,
ahead.
Again, based on my experience from working in two different cities, more proactive code enforcement, I think, is another key to the issue. So I'll be asking for some, if it's possible, funding to hire some additional code enforcement officers so we can move to perhaps a more proactive model of customer service. Catch it before it gets too worse, or have people's attention on it sooner rather than later. It would be the approach for that. But that'll be coming up at Commissioner Terry's FAB special call meeting. Thank you.
Absolutely. Any other questions or comments from commissioners? All righty, do we have a motion for this item?
I move to defer item 0683 for 30 days.
All in favor? Aye. Motion defer, or item deferred. Do I have, no, it's 3:30. Okay. All
You
right.
have time.
Wonderful, I have time. Okay, oh, is that because it's also a D1 item? I'm
Strangely,
teasing.
yes. Yeah, it's weird how that works out.
Item 2024-1233, all commission districts. This is a resolution asking for the DeKalb County Police Department to develop a diversion policy regarding unhoused individuals that considers other options to arresting and jailing them.
Thank you, Madam Chair. This item came up last year, roughly or shortly after the Supreme Court announced that it's okay to arrest people for being homeless. And I know that's not the perspective that DeKalb County has with our officers or with a lot of the programs that we put up individually or as a countywide approach to dealing with homeless folks. The intent, or what the words were initially, have been reviewed and been considered by the administration. I don't know if Chief Patrick is still here. Oh, there he is, right there. Chief, to confirm, no concerns from what the language of the current resolution has for the police department?
No, sir, no concerns. I've reviewed the wording, and it's in line with what we do and our standard operating procedures now, so there's no issues.
Okay. Thank you, Madam Chair. I'm sure there's going to be questions from our colleagues, and appreciate your time. Thank you.
I did want to clarify, I know early on we talked about whether this should be classified as, I know it's just wordsmithing, but a reaffirmation of what the DeKalb County Police Department is already doing. Is there still an interest in that, just to confirm this is not a new concept, but something we want to make sure the community at large knows is going to be ongoing and supported by the commissioners?
I have no objection with the specific language as long as it is something that the police department, which is ultimately charged with enforcement, is comfortable with.
No issues, sir. We've got our community policing, our mobile crisis, they're not going anywhere. If anything, we want to add.
Okay, wonderful. Commissioner Johnson, did you have something? I thought I saw your hand.
Well, yeah, just to kind of piggyback off of what you were saying, I kind of do like the little bit of wordsmithing you mentioned, of reaffirming, because it also makes it clear that these are things we've been doing, and just emphasizing that we are affirming to continue to do those things, that it's not necessarily something new. So I do kind of like the idea of the wordsmithing, but in general, I don't have any issues with what's being brought forward.
Commissioner Terry?
Thank you, Madam Chair. Yes, I think the reaffirming makes sense, and maybe one little tweak can be something to the effect of when DeKalb Police started approaching this issue with, not incarceration, but community policing, crisis response. So, I don't know, maybe there's a, since year so-and-so, the
Yes, sir.
police department's been committed to, addressing homelessness in a comprehensive manner,
Yes, sir.
something like that.
Yes, sir.
So, do you happen to know what year? I know you've been here for a long time, so.
I've been here 28 years, but I'll have to go back and see exactly how long. But from as far as I can remember, I mean, we've done the homeless counts with community development. We've worked with nonprofits. We've had mobile crisis since I've been here, not in the structured unit that it is now, but mobile crisis has existed since I've been here. Community policing unit, dedicated unit to community policing is new, but the holistic approach to the homeless population has not changed in my 28 years.
Okay, well, that's great. Yeah, so maybe that's kind of the reaffirming, is that DeKalb has always been a leader, and then, over the years, we've added more resources, particularly I think the mobile crisis unit and community policing was sort of a big initiative the last several years, which, you know, certainly makes a big difference. And then the only thing I would recommend adding to this is, since other jurisdictions have their own police departments in DeKalb County, they may or may not take a similar approach. So maybe we could share the resolution with those.
Absolutely.
And just say, hey, you know, join us.
Right.
In this. And I think they're all on board, but, you know, because they're doing the mobile crisis with Claritel. But I think it's always good to send our colleagues in our cities, hey, here's what we're looking at, and, you know, reaffirming, you know, join us in that.
I'm sorry. Go ahead, please.
Go ahead, Commissioner Davis Johnson.
Yeah, so is this a policy? Has this been a policy in the police department, or has it just been something that you've done?
It's not a
Would
written-
this be a formal policy?
Yes, ma'am, we can absolutely put it
Yeah.
in policy. We can create the policy.
So
that-
this would be a development of a policy?
Yes, ma'am.
Rather than a continuation of a policy, because there was no policy in place. And I think it's important to people to understand that we have a policy now. You may have been doing something, but if it wasn't a policy, it wasn't a policy, a formal policy. So I like the language that we have. And then as you bring municipalities on, Commissioner Terry, you're bringing them on to our policy, our official policy.
Yeah, good point.
Yeah.
And as far as the policy, ma'am, if I may, we do have policy that governs our mobile crisis unit, our community policing unit, but it does not dive down to this specific issue and how, but that's something that we could easily look at, right, and with the law department's review, then institute it into policy.
Did you have something else, Commissioner?
No. Oh, you talking to him, I'm sorry. And you was looking at him, I'm sorry.
When you lay back and cross your arms, I know you did.
I was only going to affirm what Commissioner Terry said, which is I think if we can get something passed out of here, or when we get something passed out of here, this would be a great thing for, if we could borrow the CEO's staff. Martha Ravello would be the excellent person to convey this to our municipalities and sort of see how we can build collaboration on the police front as it relates to the homelessness issue. And I don't want to speak anymore, but I do know that Attorney Welch is here.
Go ahead.
Thank you, ma'am. I just wanted to note, we have been paying attention to this conversation. We do have a draft. I apologize we did not distribute it before this meeting, but it does incorporate a reference to current practice because we
Okay.
understand there's not a policy in place, and it does encourage the cities within our borders to adopt a similar practice. So we're listening here today, and we will send a red line based on this conversation.
Will it be so exhaustive that we would need a substitute item, or is it more just wordsmithing?
Well, anytime that we are changing the actual attachment, we will need to substitute.
Okay,
So,
I got you. Any other, you have something
No.
else?
I
Okay.
was just gonna make
Go
a
ahead.
motion.
Matt, is there a time frame that you think would work appropriately? Is this 2 weeks, 30 days?
I think 2 weeks would be fine, sir. We have a red line. What I heard today doesn't, I don't think is going to take many changes beyond that, so we should be able to have it distributed to you all this week
Oh,
for
wonderful.
discussion at the next committee.
Did you have something else? I see you getting ready. Go ahead.
Matthew, if, because I'd like to make a motion that the substitute be approved. I'm sorry.
I'd be okay with that.
Oh, okay. Thank you. And so, what I wanted to ask, would we have a substitute
Yes, ma'am.
if it comes Tuesday?
Yes, ma'am. I should be able to have, again, I should be able to have the substitute out to you guys in the next couple of days.
Okay, thank you.
And barring any concerns with that, yes, it would be right for adoption on Tuesday with a proper motion from this committee.
Okay, then I make a motion that the substitute be adopted.
Second.
All in favor? Aye. Congratulations, you have a
Hey,
recommendation.
thank you very much. Okay, now it's PWI.
No, you got one more.
I'm kidding, I'm
one
so
more.
kidding. I am kidding.
That's funny. That sounds like me.
Okay. Okay, we can do that. Wow, so we've gotten to nearly the end of the agenda. This is the first time in a long time we only have one item remaining before conclusion of the meeting. So if we could take item 20250390 at the top of the meeting next time, because we've been holding this for a really long time, if that's okay with the remainder of the committee members.
Are you sure? Because I'm,
Because it's,
it's gonna be, okay. All
well,
right.
it be, unless you make it loud.
I think that's what he was saying.
Yeah, it's, oh, okay.
All right, it looks like we'll be okay. So now that we are at the end of our agenda, do we have a motion?
Motion to adjourn.
Second.
All in favor? Aye. Adjourned.
3:50 for PWI, and we will get started sharp. Thank you, everybody.